And we're looking at the male here. We're looking at a couple of layers starting off. And we're looking at the testicles again. So we're looking at a tunic. Tunica vaginalis and Tunica albigenea. Okay, so what I want you to notice here is that first of all, this is the scrotum. So this is the nice wrinkly sac that the testes descend into right before birth. So the scrotum layer, the layer outside here, this is your tunica vaginalis. That little layer right there on the outside of that, that's your tunica vaginalis. And then this layer that lies right on the testicle is the tunica albigenea. Okay? Now, underneath here, this cross section is showing you seminiferous tubules. So all of this area in here is the tubular network inside the testes. Okay? This little hat right here is showing you the epididymis, head, body, and tail. All right. This kind of shows you a better sac on the outside. That's your scrotum. And notice how wrinkly the scrotum is. That's due to the dortus muscle. The dortus muscle makes that skin wrinkly there. Okay. Now, when you look at the epididymis, I want to say again, when sperm develop, they move from here to here. And they're going to move through several tubule sections before they get to the epididymis. So, when you look at this model, again, this is the epididymis, head, body, and tail. Now, look at that tail closely. Look how the tail becomes the vas deferens or the ductus deferens. See that nice pink? Let me take it apart right here. I'll just take that off. See that nice pinkish layer right here? That's your ductus deferens or your vas deferens. I learned it as vas deferens, although I am seeing ductus deferens a lot lately. Now, the sperm, when they start to move, they'll move from the epididymis up through the vas deferens. Now, notice how the vas deferens is located inside this. That's the spermatocord. So the males have a spermatocord that will house the vas deferens. All of those vessels you see there, and this is on your supplemental sheet, your paniform venous plexus. I know. Even when I was studying, I was like, paniform venous plexus. Then the artery in there, which is red, is the testicular artery, and then you have a testicular nerve and lymph supply in this spermatocord. Now, we're going to follow that vas deferens, though, because that's where the sperm are. The sperm will move up through. Look how it comes through this inguinal ring, and that vas deferens shows up right here. Okay.
So you could tag it anywhere.
Yeah, you could tag it here. You could tag it there. You could tag it on this model. You see it go right past. What's this right here?
Ductus deferens. No.
Urethra?
Ureter.
Oh.
Don't mix that up.
Oh, shoot.
Because we've had people do that. You know, they'll look at that and say, ductus deferens. And it's not. You can clearly see it going into the bladder.
Okay.
So the ductus deferens comes down and runs into this area. Now, this is known as your seminal vesicles. So notice how the sperm passed the seminal vesicles. Now, the important thing here is when the sperm moves through this area, they pick up semen for the first time. So sperm, when they move from the actual testicle to the epididymis and up the vas deferens, at first there's no semen. It's just sperm. Once they move here, they'll pick up quite a bit of semen. Something like 65-70% semen. Okay? And so the semen is helping to nourish them on their journey, because this is a long journey. So you have to respect the sperm. Okay. So the sperm move into this area. Now, of course, this is your prostate gland. And You have to get down here close to see this. You have a little slit right there. So get it in there close. That's called the ejaculatory duct. And as the sperm fill in that area, the prostate gland will also give off some more semen. Some 30% of semen is picked up here. The ejaculatory duct is where they'll move in. And as they move in there, you're going to have a valve that's going to close over the bladder. Because before sperm can move into the urethra, there can be no mixing of urine and sperm because it'll kill the sperm. Okay, now, then they move out into this area. Now, of course, from here to here, that's your prostatic urethra. Then they move into this area. That's your membranous urethra. That's kind of short right in there. But you have another gland right here called the bobourethra gland.
Bobourethra?
Yes, bobourethra gland. Now you can call that Cowper's gland if you want. Cowprs. It's an easier spell. This will also give that last shot of semen to the sperm, some 50%. Then they move on into the spongy urethra. And then from the spongy urethra on out of the gland's penis. So again, the corpus cavernosum looks like squares. Look at that. So you can kind of see, erectile tissue, blood filling into that area, allowing the penis to become rigid. Okay? And then you see the corpus spongiosum totally surrounding the urethra. So that makes sense. So now when you turn this over, you can see the gland's penis. This portion is the gland's penis. Now this skin that was cut back, this is the prepuce or the foreskin. Now we do have a undissected penis where the foreskin hasn't been removed. This foreskin here is pretty thick, so you have to really pull it back to see the gland's penis. But most people have circumcision where they get rid of most of that tissue. Okay, so the penis we're going to look at today is uncircumcised, so you'll see all of that skin. And I will tell you that that skin has lots of receptors in it. So I think males that still have that foreskin may get a greater stimulus there. They may get a greater